Dr. Leah, a 24-year-old bride-to-be writes, I'm getting married soon, and I'm still a virgin. I'm wondering if there are any tips to make my first time less painful.
First off, have some realistic expectations. A perfectly synchronized, mind-blowing orgasm probably is not going to happen the first time. Amazing sex usually comes with a lot of practice and really knowing your body and your partner's body. So I know there's a lot of pressure for your wedding night sex, but try not to stress about how the first time plays out. I mean, after all, you have an entire lifetime to figure it out. People's experience of losing their virginity really does differ significantly. Some people say that it hurts, while others report no pain at all. Some people believe that the tearing of the hymen, that thin layer that often covers the vagina, explains the pain that some people experience when they first have sex. However, many people lose their hymen with a variety of different activities before intercourse comes into play. The pain may instead come from inadequate lubrication, anxiety that causes those muscle spasms, or maybe a partner that just rushes too much into it or is a little too forceful. Starting out with a lot of foreplay allows you to spend time touching and exploring, getting comfortable and getting lubricated. Regardless, open communication is the key. Discuss what feels good and what does not. Doing that can ensure that both people enjoy the experience. A person should never assume consent to a particular sexual activity, even if it is your wedding night. People should stop any sexual act if a participant feels pain and wants to stop. So you might want to discuss what types of sex you plan on having before the night. Is it strictly penetration? Are you going to incorporate oral or anal? Discuss what sensations you previously enjoyed during foreplay, masturbation, or any other types of stimulation, and try to incorporate that. Some women need clitoral stimulation as well as penetration, and that might make the experience a little more pleasurable for you and a little less painful. Also, go slowly. When you slow down the pace, this allows the body to adjust to the sensations, and it makes it easier to communicate about what specifically feels good and what does not. And it also allows you to try a bunch of different positions. Certain angles may cause more pain than others, especially if you're hitting the cervix.
A 65-year-old woman wonders, I've always been able to orgasm easily, but for the past year, I've been losing almost all sensation. Should I tell my doctor? I take insulin for type 2 diabetes.
It sounds like you have diabetic neuropathy, which is a very serious, very common complication of diabetes 1 and 2. The condition usually develops slowly, sometimes over the course of several decades. But essentially, it's a type of nerve damage caused by long-term high blood sugar levels. If you have any numbness, tingling, pain, or weakness, you should absolutely see your doctor. You may also be suffering from autonomic neuropathy. This affects the systems which run the involuntary systems in your body that do the things that you cannot consciously control, like your cardiorespiratory system, digestive systems, and even sex organs and bladder. So it's unsurprising that autonomic neuropathy can cause sexual problems, such as erectile dysfunction, vaginal dryness, or difficulty achieving an orgasm. It also causes numbness, pain, or lack of feeling in the genitals, which may inhibit orgasm or make it difficult to feel sexual stimulation. There's a ton of research on the relationship between diabetes and sexual dysfunction, so absolutely go see your doctor as soon as possible.
Is it true that vasectomies can reverse on their own, possibly leading to pregnancy? How common is this?
It can happen, and it actually can occur in up to 9% of all procedures. But most of the time, it happens within the first 12 weeks following the procedure. And it happens because the vas deferens grows back to create a new connection, causing the vasectomy to essentially reverse itself. If recolonization happens after the post-operative sperm testing, it may go undetected until that person's partner gets pregnant. But don't worry, late failure is way less common, with an estimated failure rate of less than 0.1%. Keep in mind the risk of recolonization may increase if a person chooses an open-ended vasectomy, which closes one end of the vas deferens, or if there's sperm tissue at the vasectomy site.
A young viewer writes, I can't climax. It doesn't happen during intercourse or during masturbation or oral stimulation. Should I see a doctor? Or maybe a sex therapist?
If your lack of orgasm from sexual activity is stressing you out, then you should absolutely make an appointment with your gynecologist or a sex therapist. Just understand that you are not alone. In fact, this is something that 10% of women experience. It's called anorgasmia. There are many different causes. First off, lack of sleep is the #1 cause of low libido. Some medications are also to blame, such as antidepressants and birth control, which can lower your libido. Even a poor diet can have an effect. One that is low in iron, making you tired, and one that does not have enough healthy fats can reduce your libido and lessen your likelihood of orgasm. Other reasons could be maybe poor communication with your partner or even just lack of skill of your sexual partners. Also, there are some people that just are unable to relax due to feelings of either guilt or shame resulting from a very strict upbringing or even a past traumatic experience. If that is the case, a psychologist will definitely be beneficial. If you feel as though none of these fit, you may just be thinking too hard. When you start to focus too much on the orgasm during sex, it might actually lessen the likelihood of having one because you're all in your head. You might feel that disappointment and frustration because you're not having an orgasm, which makes it even more frustrating and less likely to happen. So ask yourself, before you get in the bedroom, why do you think you're having such a difficult time? Does it feel like you're gonna peak and then stop? Does it just kind of fade out? Are you never really excited to begin with? I would definitely talk to your gynecologist and ask her if there's a medical reason that could be causing your difficulty in orgasm. Ask her what kind of tests you need. Do you need to make any changes to your lifestyle? Or if there's a particular treatment approach that's recommended. Make sure to tell your doctor about your sexual history, including any history of sexual trauma or abuse. Also inform your doctor about any medications or supplements that you take.